Now, allow me to introduce Associate Professor Dr. Nandu Goswami, Acting Head of the Physiology Division and Head of the Research Unit for Gravitational Physiology, Aging and Medicine at the Medical University of Graz, Austria. He's a strong advocate for integrating complementary and holistic approaches into mainstream medical education and coordinates international seminars on evidence-based integrative medicine. Professor Goswami, the stage is yours.
Thank you so much. Thank you so much. Good afternoon, ladies and gentlemen. I know I look a bit different from the picture, but that's because I've been in Dubai and it's very hot, so the hair got burnt. So this is my way of, thank you so much, Thomas, for inviting us and initiating these, sessions. They have been amazing, and it's been a pleasure, really, to be associated with you. Thank you so much. And I think everybody knows here about Ayurveda. Everybody knows about the topic. But I just want to start by saying that I am not an Ayurveda practitioner. I am just a medical doctor, simple, good old heart doctor. So how did I get involved in Ayurveda? That is, of course, because of the Indian embassy in Vienna that has been calling me and saying, listen, you're an Indian, can you support some kind of Ayurveda research? I am, as you heard, I was the head of the medical physiology unit in Graz for many, many years. And the only thing I said, we have to be a bit careful. So I went to the first rector. I'm so glad he's no more the rector. He just told me, get out of my room. We do not talk this kind of nonsense in Austria. Really, Clara, that's for you. Where are you, Clara? She was just presenting. These are the obstacles you'll be having. Luckily, he was changed. We have a new rector then. He was a little bit more receptive. He said, as long as you do it, you have to talk with me. Talk what? We said, well, he said, you have to talk with me. So the whole problem starts, and this is where I think it's very important for all of us to understand. Ayurveda works, we know that, it's 5,000 years old, that's all great. But now, please fast forward to the modern medicine world of Europe. Where is the place for Ayurveda? And this is where the whole problem for us actually started. Because, you know, in India, we have been carrying out this practice for thousands of years. There's no problem. But the moment you mention it in Europe, actually in Austria, we had these issues, as I mentioned. And then we organized a meeting with the Ayush, and actually even Ayush-sponsored part of it, in Graz. This was way back in 2017. And we had a meeting, we could only get about 10 or 15 people. Some of them, you actually know, Dr. Madanji, for example, has been supporting us from day one. And, we are grateful to his expertise. There was also Rainer Picher, who is a traditional, normal Austrian doctor, but working in traditional medicine. So my idea was very simple. Why don't I, as the Indian, talk about Western medicine? And let me get the Austrians to talk about Ayurveda. So I got some few Austrian traditional or alternative or whatever you call them, but they're all medical doctors who were actually practicing some kind of Ayurveda in Austria. You know them also, many of them have come to these meetings before, like example, Rainer Picher, and also our Wolfgang from the northern part of Austria. They have been practicing in this part of work. So I said, let's combine that. So that's what I have been trying to do. And when we had our meeting in 2017, I still remember, the first thing the vice rector of my university, she actually sat in the same front row like Catherine, and she told me, Prof, no nonsense. I don't want to hear any nonsense. Please talk science. This is not voodoo. She actually used the word voodoo. This is not, as you heard from Fadil talking about, decolonization and what black people are perceived and white people. No, this is 2017, not 1851. They were actually telling me that's voodoo. In Hindi, we call that Jadoo Tona, of course, for those of you who know Hindi. And she told me, this is not magic. We are not going to do magic. I want to hear science from you. And I was just saying, yeah, I'm a medical trained doctor myself. I am only going to do science. So I understood one thing, that Ayush can say whatever they want. Anybody in the world can say, Ayurveda works. the Western world doesn't give a damn, at least not the Middle Europe, because it is considered completely not legal. In Austria, you cannot import any Ayurvedic medication in any way, except maybe as a food supplement, which is also problematic. And so please be aware of that, and these are the obstructions that we have. So I, as a professional academic, working as a professor, was faced with this dilemma. Because on one side, my mother, who is 90 years old, believes in Ayurveda. And I said, you know what? Let us give it a chance. So I started looking at the literature. And now comes the next part. Because when you look at the literature, you actually find that the Western practitioners, even many of the doctors I spoke to in Graz, just told me this is complete nonsense. Where is the evidence? And they actually call it alternative, which is very sad. Because I, as a medical doctor, and many of you are medical doctors here, you know this. If we are sick, we talk about treatment. We never talk about prevention, which is exactly Ayurveda. You heard from every presenter here, about the research, veganism, or other aspects as well, such as, taking care of health promotion. You heard from our colleague talking about, showing art to the lady who was sick. All these aspects. But, the problem is when you put it as alternative, and which is the fact in the Western world, it becomes really a problem. So I started looking at the literature. And then I found out that there is a big bias. If you want to publish an article, I think we can tell always to Katharina about that. She knows, even though it was not even about Ayurveda, try publishing an article about Ayurveda. I want to hear this. Please go to an English journal and try to publish it. Let me see who will publish it. And those that get published, most of the articles come from India. There is a publication bias, of course. Again, I'm talking, and people are actually saying, oh, those are all fake data anyway. That's, again, a problem. So when I was faced with this aspect, my question was, how can we do it better? So what should we do? So I said to myself, why don't we just try to do things that are going to be not conflict of interest? This is what happens to me. Every time I go to Ayush meeting in India, many of the practitioners come and say, here, this is a powder, test it on your patients. That's nonsense. That's not going to work. Sorry. Because we do not know. We are Western-trained physicians and pharmacists and pharmacologists. We do not understand that you just take a powder and test it. So that led me to this question that maybe I need to raise awareness among the Western practitioners. So that's why I brought Raina Picha, who is a medical doctor, but working in some kind of Ayurveda, got him involved. But then I always tell the people, I am not a practicing Ayurveda practitioner. All I am doing is trying to use Western methods to see and to test Ayurveda. That's exactly what I do. So I stay backward. This is interesting because normally you expect an Indian to be advocating Ayurveda, which is conflict of interest anyway by default. I don't, because I don't even know that word, what Ayurveda means. I know it's a life, but I am not an Ayurveda practitioner. So I believe this is the best combination we have. So I started saying, why don't we approach Ayurveda in a way that we approach a new drug? So if you get a new drug, what do? We normally do, of course, pharmacokinetics and all that. And of course, you have been hearing this keyword, EBM, evidence-based medicine. Why don't we just do that? So, of course, carry out trials. So I thought that the best way is to let us now talk about. So if you give me a powder of Ayurveda, that's fine. First thing I will do, I will test its purity. Then, once I know the compounds in there, because there can be sugar, there can be arsenic, anything, and Western medicine wants a pure compound in there. So where is the pure compound? We need to find that out. So why don't we just do the pharmacokinetics? Then, once we have done that, let's try to test this particular medication in different scenarios, like you would do for a drug. And then once you have already found out, you saw the canonical diagram our previous colleague drew, try to see how the drug works at different levels. And once we do that, we'll be able to say what exactly is the effect of that drug. And then you can do some animal experiments, which is what we do normally, and then finally, the human studies, which I believe where Ayush and everybody can help us, they can do the human studies in India. But we have to prepare the platform. So that is how I started with this, and that's how I got involved. So these are some of the preparations. Can we try to give this to our patients? So we need to know what is the component in there. We then need to know how does it work at a different cell level. Again, I don't want any one of you to become molecular biologists here, but normally this is how drugs work. They have different effects. Also, we can test the different effects of the drugs. And then once we know, then I'm very sorry, but we also have to do animal studies, of course, in which we try to find out, for example, this particular breed of mice, they die from heart attack. You don't have to do anything. They will just die from heart attack because one of the genes is missing for them. And because that gene is missing, and if you say now our Ayurveda drug is going to reduce your cholesterol, let's feed that mice and see what happens. That's how we do normally. So this is how some studies that we actually do. And then, of course, you can take all their organs. Why is this important? Because I personally believe, as a medical practitioner, that we have a bigger problem in Europe, which is what I think Ayurveda can help. It's not just health promotion, but also advocating for some other effects, trying to see which medications, which are not medications, but natural products, how can they help in the patients, for example. And you know everywhere, you can see the statistics, people are aging in Europe, all over the world. And if you look at the areas here, there is going to be additional extra costs that we have to cover for our taking care of our medical, the older persons. The areas in the pink, for example, shows the extra cost that we'll have to pay for the hospitals. We are very happy that our older citizens live longer. That's great for the healthcare, but we also have to come up with extra costs for them. So what we do in Graz, and that's what exactly I do, is we do a lot of testing of the older persons. So for example, this is a gentleman with stroke. He had stroke, and he is not able to walk. So we normally test him. So I said, why don't we have one group that doesn't get the Ayurvedic supplement and another one that gets the supplement, and then let's see that. So that's what we are trying to do. We can monitor, you can see brand new equipment. This is not Ayurvedic equipment. This is all Western equipment. All the device we use in the hospital. Every doctor knows this. We can measure blood flow to the brain. For example, we know this drug called Brahmi, which is believed to improve blood circulation to the brain. Where is the evidence? Who has tested it? It's not enough to say that my mother said so it was good, or that's not enough. Western medicine wants a proof. So why don't we monitor the blood flow to the brain? The same things we do in every other old person. So we can do that for you. And then once you do that, you can do, of course, also how stressed they are. This is a complex picture. This was given to me by my colleague, Maximilian Moser, who many of you are familiar with. He provided that. This gives you an idea about how the heart, as you heard from the previous presenter, somebody asking, why don't we tune the vibration rings in our... This actually assesses how stressed you are. So sympathovagal balance. And once we know that, I can do a lot of things with your heart rate. What happens to your sleep? How stressed are you? How are you coping up with your work? What is the chance that you will actually get a heart disease? Because if you don't sleep properly, you have a problem too. So we can do that. And I'm saying, why don't we do this for Ayurvedic medication? We give somebody Ayurvedic supplements, nutrients, and then we test them using exactly the methods that are already validated anyway. I have more than 50 papers on this scheme anyway. So that's why I think it's important that we understand that part. So not only the heart, this is just for the heart. We can actually look at the vessels as well. You know, all our arteries, they have a lining inside, what we call the endothelium. This is the generator of the heart disease. So in future, if somebody gets a heart disease, so patients always come to me and say, doctor, my father died of heart attack. What is the risk that I will die of heart attack? And I say to them, let's test your endothelium. We do that routinely anyway in the hospitals. So why don't we test the endothelium before and after the Ayurvedic supplement? So we can see, and it's very easy to do, because if there is something wrong with your endothelium, the chance that you will get a heart disease 3 years later is much higher. So I can actually predict for you. Then I would know if that supplement works or not. And that's the way to go. There are no shortcuts in life. I'm very sorry. The problem is there are no shortcuts. People just want shortcuts. They want the powder works. That's good. It's not like that. We have to do evidence-based medicine in a language that the Czech doctor understands, that the Austrian doctor understands. They will all approve that, provided they see how we do. Very simple ways. None of them is a needle. You just put a probe, we test your blood pressure before and after. And if you have enough nitric oxide, which is something that makes your arteries open, there you go. The drug is working. Supplement, I would use that word. And so they're very easy. I mean, Dr. Fadil from South Africa, who was just giving his talk on, we are using this device. You know, Dr. Fadil, about this in South Africa, in HIV patients, where we are trying to see the effects of the HIV drugs. So this method is already used. Let's use that. Pre and post nutritional supplementation from Ayurvedic products that we give. Very easy to do. None of this one tests how thick your arteries are, how stiff your arteries are. You just lie down, blood goes there, and we test before and after your supplementation you got. So the same, but you know all those changes here, if you look at the artery here or the artery here, these are big arteries. You may not see the changes. Or by the time you see the changes, it's too late. So why don't we look at the small arteries in the eyes? Because the changes, you will expect them to happen before in the small arteries. So now I give you a supplement, we look in your eyes, and this is a camera. I mean, many of you have seen this in the hospitals. When you go to test with your eye doctor, he or she is using this. But hang on, we also have the mobile version that you can use in children too. So very easy to use. And the picture that what we do from there is we look at the picture and then we are able to actually see what is happening in the eyes. So small changes we'll be able to detect. The same goes for blood. Of course, you know, when you go to a hospital, they take your blood or saliva. But based on that, you can see all the genes that are going up and down. We do this all the time. So why don't we do this for Ayurvedic supplementation? You can see very complex diagrams that we can draw actually after that. And so that is what we have been doing with our colleagues in Austria. And the Medical University of Graz is now so convinced, because after warning me and threatening me and almost killing me with, you know, hocus pocus, dangerous doctor, voodoo, they're all now happy. They even come to me and now saying, doctor, you are doing great work. Because now the university realizes they can get some money. It's all about money, isn't it? So now they are very happy. And so we have actually had almost for every year an event in Graz where we actually combine, again, look at the word, I don't use complementary medicine. Please stop using that word. Stop using alternative medicine. Say health promotion medicine. When you do a meditation, people get panicked in Austria. These are dangerous people. They are a sect. We are not a sect. We are trying to improve your way of life. What time you go to sleep? What is a good nutrition for you? What should you be doing to clean up, to detoxify? If you go to India, they talk about panchakarma. This is pancha means five treatment. What is that? They give you some medicine and you have serious diarrhea and vomiting. But hang on. Is that not what is detox therapy in every people pay 12,000 euros for that? Or you just go to, my advice, just go to Bombay for 1 week, eat on the roadside. You will clean up everything, you will reset your detox. But this is what I'm saying that but you know what I mean, that what I mean by resetting the microbiome, where people pay thousands. Actually, it's very simple. This is something we all do. So this is something that, but now the Western medicine is talking about, yeah, we have to do detox, 12,000 euros. But this is already something that is mentioned in Ayurveda a long time ago already, 5,000 years ago, where they were talking about panchakarma. So why don't we try to validate? So what I do is I actually give people, what we normally do, we work with the Ayurveda centers. We actually measure all the arteries before. Every single thing that I mentioned to you before, the arteries in the eyes, the arteries there, blood flow to the brain, pre and post, whatever you call it. Call it detox in Europe or panchakarma in India, it doesn't matter for me. The bottom line is we can measure. And once we validate that and we publish that, in a Western journals, and I swear to you, they will never refuse our publications. I have more than 180 publications. And if I publish with the same equipment that I have been publishing in the last 180, nobody is going to refuse us. I believe that is the way to go forward. And you will not believe this, that the university actually came back to me. I don't know, it's hard for you to read from the back, but we actually created a course that is called integrative and complementary medicine. And the whole idea is evidence-based medicine and research. If you go this way, you will be able to convince. And again, they are telling me that yoga word, that Ayurveda is a dangerous word. I said, yes, the Ayurveda is just a way of life. And so you can see the different elements we have, but we follow exactly the same way. We give them the literature, we give them the background about what we do, we show them what we are doing, and this is what we have been doing. And so this course is actually running in Austria, at the Medical University of Graz. And so many students are excited because this is about health promotion. And everybody comes to me and says, this is the only course that talks about health promotion, not about treatment. Because, and I always believe that, of course, they go hand in hand. You promote health, and if things go bad, then you will have to take some kind of treatment. But if you take some treatment, we should be able to validate it. Tell the Western people how it works. What is the pharmacodynamics? What is the pharmacokinetics? Perfectly all right. If we do that, everybody will be happy. And just as a last note, I would just like to say that I know you will not believe this, but the most serious aspect that anybody can have is cardiac surgery, heart surgery. We have gone to the university, we have got ethics approval, and we carried out a study. I swear, we didn't test Ayurvedic drugs because we were not yet that far. So I started with yoga and meditation. Again, be careful with the word meditation too, because many people misconstruct that as, again, you know, some sect together. But if you explain to them mindfulness, they understand that. So the yoga and exercise, we actually gave it to our patients who are recovering in the, you know, once you get a heart surgery in Austria, I'm sure it's the same here, you get a rehab for a month. And during that time, they go to the hospital. And they are in a hospital setting, so perfect, because they get the same food. So we tested 3 groups of people. One with the normal exercise, Western exercise, another one with Western exercise, plus meditation, and the third one with meditation, with yoga and exercise. And the results are amazing. People are so excited. So, my dear friends, and Professor Thomas, thank you so much for inviting me to share my research. But I believe there are no shortcuts in life. If we go this way, and we actually do it evidence-based medicine, there is nobody who's going to doubt us. Thank you so much. Namaste. Namaste.
Professor Goswami, thank you for sharing your expertise with us. Thank you very much.
Thank you so much.